Time now for our U18 Sports Medicine Timeout, brought to you by U18 Sports Medicine, your sports medicine provider for the young athlete. And joining us now is Dr. Jeremy Frank. Doctor, let's talk in this segment about hip injuries and how they affect the young athlete.
Absolutely. We're seeing, with better MRI technology, we're seeing more and more hip injuries in the young adult. Anything from a hip pointer, a pulled muscle, to a labral tear.
We saw A-Rod, might not be a young athlete, but obviously A-Rod, very successful athlete, had hip surgery and was able to come back and have a very successful return.
Absolutely. A-Rod had a labral tear, which is becoming more and more common, or something that we're picking up on our imaging studies more. And that's something that we can't just ignore like we did in the past. And oftentimes that may require hip arthroscopy surgery, where we go into the hip with cameras and fix it. And there is a rehabilitation process afterwards, but we're usually able to get the kids back to the field of play.
One of our earlier segments, we talked about knee injuries, and a lot of it occurs because of overuse. Is that the same case with hip injuries?
Absolutely. As kids mature, their bones grow at a different pace, and so some injuries are a result of overuse. Others are just a freak accident that might occur on the field.
Should they have an accident or an injury early on? What are some of the measures that should be taken right away?
Ice and elevation is always a good thing. Stopping activity, and then going to see a competent orthopedic surgeon who can evaluate the injury and make a diagnosis and form a treatment plan.
All right, doctor, thank you very much. We appreciate it.
Absolutely. Thank you.
Dr. Jeremy Frank with our U18 Sports Medicine Timeout.